Welcome back. Today our topic is pancreas anatomy and physiology. Before going to talk about pancreatitis, we must know about anatomy and physiology of the pancreas. See, pancreas is the elongated organ. Mainly, it is 15 to 20 centimeter in length, and which is situated posterior to the stomach. So this is the post stomach, and which is situated posterior to the stomach, and the lesser sac divide the pancreas and stomach, separate the pancreas and stomach, and which is located at the L1 and L2 vertebral level. Pancreas has four parts. One is head, neck, body, and tail. See, head located at the concavity of the second part of the duodenum, and tail located at the hilum of the pancreas, sorry, spleen. This is the spleen, this is the hilum of the spleen. Now the pancreas duct anatomy. Pancreas has two ducts. One is main pancreatic duct, which is traveling from tail to head and draining from tail to head. Here at the head level, which will join with the common bile duct. See, common bile duct formed by cystic duct and hepatic duct, which will drain the bile fluid, and the bile duct, common bile duct and pancreatic duct will join and form the single canal, and which will drain into the major duodenal papillae. Here the hepatopancreatic ampulla, which is a musculature, act like a sphincter, which will prevent the reflection of duodenal secretions or fluid towards the common bile duct and pancreatic duct. So other than this main pancreatic duct, which has accessory pancreatic duct, which will drain the posterior part of the head of the pancreas into the duodenum through the minor duodenal papillae. Now the arterial supply of the pancreas. Pancreas supplied by mainly the superior pancreatico-duodenal artery and inferior pancreatico-duodenal artery. The superior pancreatico-duodenal artery has anterior and posterior branch. This is the anterior branch, this is the posterior branch. The superior pancreatico-duodenal artery is a branch of gastroduodenal artery, and which is a branch of common hepatic artery, which is a branch of celiac artery. Celiac artery is a branch from aorta. So apart from that, the inferior pancreatico-duodenal artery. This is the inferior pancreatico-duodenal artery, which is a branch of superior mesenteric artery, and which is divided into the anterior and posterior branch. So both superior and inferior pancreatico-duodenal artery will supply entire head of the pancreas. Other than that, the pancreatica magna artery, which is a branch of splenic artery, and which also supplies the entire length of the pancreas, the body, head and tail. Now the venous drainage of the pancreas. The pancreas arterial supply also the pancreatico-duodenal artery, like that. Here the superior pancreatico-duodenal vein and inferior pancreatico-duodenal vein drain the head of the pancreas. Superior pancreatico-duodenal artery drain into the portal vein, and inferior pancreatico-duodenal vein drain into the superior mesenteric vein. And other than that, see, the splenic vein and inferior mesenteric vein also drain the body, neck and tail. Now the physiology of the pancreas. Pancreas has two functions. One is exocrine, another one is endocrine function. See here the exocrine function. This is the enlarged picture of this section into here. See here this is the acinar cells, mainly located at the pancreas. These acinar cells will secrete the enzymes like trypsin, chymotrypsin, lipase, amylase, lecithinase. These enzymes are digestive enzymes. So this enzymes has digestive functions which will drain through the pancreatic duct and drain into the small intestine, and which will digest the food which is coming through the small intestine. So exocrine function. Now the endocrine function means which will secrete the hormones directly through the blood vessels. Has two cells, one is alpha cell, another one is beta cell. This alpha cell secretes glucagon and beta cell secretes the insulin. So in this chapter, in the general surgery, we are going to talk about pancreatitis, pseudocyst, chronic pancreatitis. So we should know about the enzyme function. So we are not going to talk about the endocrine function detail. So only we are going to talk about the exocrine function. Now the pancreatic secretion control. How it is controlled by the our body. See, the pancreatic secretions mainly controlled by the neuroendocrine system. Neuro means nerve, endocrine means it's a hormone. Both nerve and hormone will control the secretions of the pancreas. So we already know that secretions of the pancreas will help for the digestion of the food. So the vagal stimulation, the nerve commonly mainly involved is vagal nerve, and the endocrine hormones mainly involved in pancreatic secretions are secretin, cholecystokinin, and gastrin. So here the totally three phases are there. Number one is cephalic phase, two is gastric phase, three is intestinal phase. These three phases, the pancreatic juices get secretion. So in the cephalic phase and gastric phase, totally 10 to 20 percentage of secretions of the pancreas occur. But in the intestinal phases, around 80 percentage of pancreatic juice secretion occur. Now the neural stimulation like cephalic phase, conditioned reflex, unconditioned reflex. There are two reflexes. In the conditioned reflex, when we are seeing the food or smelling the food or thinking or hearing about the food, the vagal nerve gets stimulated. Once the vagal nerve gets stimulated, which induce the secretions of the pancreas. So this pancreas secretion occur totally less than 20 percentage. Like that, unconditional reflex, presence of food in the mouth also will stimulate the vagus nerve, which will induce the pancreatic juice secretion. Then the gastric phase, the bolus of food entering into the stomach from the mouth, the stomach cells, gastric cells secrete the gastrin, which will induce the secretion of the pancreatic juice. Here also less than 20 percentage of pancreatic juice secretions occur. Last phase, intestinal phase. This gastric and intestinal phase controlled by the hormone. This cephalic phase controlled by the vagus nerve. Once the chyme of food entering into the intestine, the intestinal cells, duodenal cells, see from the stomach, the food entering into the duodenum, the intestinal cells secretes the secretin and cholecystokinin. Once the cholecystokinin and the secretin secreted, it will enter into the blood vessels. This secretin and cholecystokinin will act on the pancreas and stimulate the secretions of the enzymes like trypsin, which will act on the protein, amylase, which will act on the carbohydrate, lipase, which will act on the fat and degrade this product. So this is the way the pancreas juice secretion occur, and the digestive process start from our body from the beginning of smelling, thinking, hearing about the food, and food entering into the stomach. Once which will passing through the small intestine, the pancreatic juice will secrete and digest the food. So we know about the anatomy and physiology of the pancreas now. then only we should know the detail of pathophysiology, management, and clinical features of the acute pancreatitis and chronic pancreatitis pseudocyst. Okay, thank you. In the next video, we will talk about acute pancreatitis, chronic pancreatitis, and pseudocyst. Thank you.